Okay, so Lydia and I are thrilled to be here with Dr. Danishmand, and in keeping with the subject of this, we're going to talk about care and feeding. So we're really talking about what it's like to live on a day-to-day basis with a neobladder from this point forward. Okay, so I want to start with some rules of the road. So one thing that's, I think, pretty clear from what you've heard already, and you should continue to keep in mind, is that your mileage may vary. In other words, something that is true for me may not be true for Lydia, or true for you as well. We're going to go through, we've already gone through the wonderful engineering marvel that is a neobladder. Dr. Danishmand did a nice job of taking us through the technical specifications. So we're going to talk a little bit about test drive. That will be a very brief conversation. Then we're going to talk about break-in period, where there's a lot of conversation. We'll talk about what it's like after the break-in period, and then talk about tune-ups and inspections. All right, so from a test drive perspective, there are a number of institutions that will have you test drive an ileal conduit. They'll have you wear a wafer and an ileal conduit. But with a neobladder, you can imagine that that's really not going to be possible. It's all internal mechanics, and so that's not going to be feasible. But there are some institutions that may recommend or support patients test driving the self-catheterization, because there may be some concern about that and making sure that patients are comfortable doing that. So there may be some test driving as far as that's concerned. Okay, I'm going to turn it over to Lydia, and then she'll turn it back to me.
Thank you, Rick. I'm going to review the break-in period during the first 3 months post-op. And in this first slide regarding post-surgery, so you will come home with a Foley catheter for approximately 3 weeks. You will notice mucus in your urine, which is normal. Typically, as the volume of the neobladder increases, there will be more dilution of the urine and mucus will be less noticeable. It's important to note that when you have a Foley catheter after neobladder surgery, including after any subsequent surgery, the catheter will need to be irrigated periodically to prevent blockage from mucus. Sometimes after abdominal surgery, some people will have a small bowel obstruction. This is due to adhesions or scar tissue forming in the gut and causing a blockage. Symptoms are severe pain that persists, sometimes with nausea or vomiting, and medical attention is needed for treatment. Next slide, please. So post-Foley, so after the Foley is removed at about 3 weeks, the neobladder capacity will be small. Over time, it will increase to contain approximately 400 to 600 milliliters, and that does vary. Some patients will be asked to continue to irrigate their neobladder, and this will be done with an intermittent catheter. A catheter can also be used to check residual urine in the neobladder after voiding. Some patients may be asked to use a catheter to routinely empty their bladder. And it is important during the post-recovery period, to stay hydrated to avoid mucus plugs, which make it harder to empty the bladder. Next slide, please. Okay, how to void. So there's a lot of variability in voiding technique. Men can sit, stand, lean, or a combination of all three. Women will sit as before. Some push, some relax. So what that means is learning to relax the pelvic floor and incorporate breathing into the voiding technique can help with successful voiding. Valsalva incorporates pushing, and Crede combines manual pressure with leaning forward. I personally combine elements of both those maneuvers, plus drawing in my abdominals while simultaneously exhaling. With time, it has become a seamless process. And it is important to fully empty the neobladder. Towards that end, some people find guidance from a physical therapist with pelvic floor training to be helpful in maximizing their voiding ability. Next slide, please. So, sensation to void. The cues that it's time to void can vary from person to person. Some people feel pressure or discomfort, like gas pain. Some will feel a sensation similar to before, but less pointed. Some people might have flank pain when their neobladder is full. And some people will have no sensation and will need to be mindful of the time since their last bathroom visit. Next slide, please. So building capacity with timed voiding. Instruction for timing bathroom visits after Foley removal may vary. Typically, the goal that is given is to go 2 hours between voids. In the beginning, I was lucky if I could wait 15 or 30 minutes. With time, though, the interval increases with gradual improvement measured in weeks, not days. Ultimately, most find they can go several hours between voids depending on beverage intake. Personally, I find I'm most comfortable with a voiding schedule of between 2 and 4 hours. It can be helpful during this time to consult with a physical therapist with pelvic floor training who can devise a program of pelvic floor muscle exercises or Kegels to help strengthen the pelvic floor muscles, which in turn can help with regaining continence. And now Rick is going to present the next group of slides.
Okay, so we're going to talk about getting back on the road. And Stephanie, are you going to move the slides?
You can do it, Rick, or you want me to?
Oh, there we go. Yeah, I don't see the little arrow, but good. We're good. Okay, so as Dr. Danishmans pointed out, continence is a continuum. In other words, you can be continent or incontinent, but incontinent has different levels. And so there's some things to do that you can do to help manage your continence. So you may need to do some adjustment of the timing of your fluid intake, and some people will taper or stop during the evening in order to get through the night without having any problems. Caffeine and alcohol may impact your output and your continence levels. And there's different techniques that people use to get through the night. So some people, and I fall into this category, will urinate when they wake up. I wake up fairly frequently, so for me this works, but it might not work for somebody who's a heavy sleeper. Some people set an alarm clock or multiple alarm clocks because that works well for them. Some people wear guards or pads, and other people put down mattress pads and kind of work with the problem as it arises. There may be some continence issues that can be taken care of with pelvic floor exercises that we talked about earlier, which is the Kegel exercises. For many of us, it's a good idea if we're traveling to have a medical alert or some kind of bracelet or dog tag. So if we were unconscious, that there would be some indication that we have a neobladder and they would know who to contact. I would point out if you do any international travel that you should not put an 800 number because they do not work outside the U.S. And the information should include a phone number for your neobladder urologist and indicate that there is a neobladder, and any catheterization instructions. And the size of the catheter needs to be a little bit different to make sure you don't get any mucus plugs, and obviously there needs to be some saline irrigation that we talked about earlier. When you're away from home, whether you're traveling or at work, you may want to think about, having what I call an emergency kit. So you may want to have a catheter and some lubricant with you and some saline in case you need to irrigate and remove a mucus plug. I would point out that saline is a medical liquid from an airport security perspective, so you can get through the security lines with saline. Just point out to them that you use it for medical purposes. I have never had a problem with that. You may want to bring some spare underwear or guards and pads if you run into continence issues. And if you are prone to urinary tract infections, and some of us are, you may want to bring some antibiotics along with you. There's a fair amount of discipline and planning that I would suggest is necessary with a neobladder because we end up with this kind of timed voiding. So let's say it's roughly 4 hours, give or take. And so if you're going to be driving through rush hour, or there's snow or weather conditions or meetings or whatever, you may want to void earlier than you feel like you would need to in order to get through whatever this a potential obstacle to your being able to void might be. All right, and I do want to point out that there is a very low risk of a neobladder bursting, but it is a possibility. So that's important to just keep in mind and make sure that you're voiding frequently. All right, we talked on the previous slide, talked a little bit about urinary tract infections. And so those of us with a neobladder are going to test positive for urinary tract infections. Remember, the neobladder is made from your small intestine, so as a result, you're going to test positive for urinary tract infections even if you don't have one. And so the things that you need to watch for that would be indicators of a urinary tract infection, because remember, we can't count on the test being accurate, is things like fever and flank pain and foul-smelling urine. On an annual basis, you should have a B12 test. That is a test that has to be specially ordered because part of your small intestine's been removed, and so there's less absorption of B12. So that should be tested on an annual basis. It's a simple part of your blood work, but the doctor does have to order that one. There's your carbon dioxide and bicarbonate would need to be tested on a regular basis when you go to either your primary care or your urologist. But that is part of the basic kind of testing that they would do anyway. So that one does not need to be specially ordered. If you're at risk for osteoporosis, you may want to get bone density scans. And there is the possibility, some people do get neobladder stones, so stones in the neobladder, and that's going to be more likely if there's incomplete voiding. And so, as we mentioned earlier, hydration is important from a mucus plug perspective and also from a neobladder stone perspective. Okay, from an ongoing care perspective, it's probably best to go back to the surgeon that you went to, who is a specialist in neobladders. That's why you went to this surgeon. If that's not possible, and it may not be, you want to find somebody who's comfortable contacting your surgical team, and you can find local urologists that are willing to work with your surgical team. The general knowledge about neobladders is fairly limited. I think Dr. Danishman has already come out and said that, not just suggested it, but basically said that. So even among the specialists, there's less expertise out there than you might want. And it's obviously a good idea to have a little bit of education yourself and include the surgical team when there's an emergency related to your neobladder. Generally, there are no special needs if you're having surgery or a procedure, so there would be two exceptions that we want to point out to you. The first is, and we talked about this a couple times already, is that the catheter size needs to be a little larger so the mucus could flow, and there needs to be some irrigation of the mucus as well. And the second thing, and this would be extremely unusual, but there are some unusual chemotherapies that are processed through the urinary tract, and those should be avoided. But they are very unusual, and just if you have any questions on that, by all means, check with your doctor. And with that, we are going